is Davis Omanyo. An elder in this church, as a vice chairman to the provost, and I'm also the chairman for finance and a lay leader in this church. I've been in this church since 1989. That's about 31 years. So this is my church for the last 31 years with a break. I take this opportunity to thank the provost. I take this opportunity to thank the provost and the elders of this church to give me this chance to speak to the congregation wherever they are, and other people may not be members of our congregation, just to talk about what we are going through now as public health. I'm a public health consultant, and so what's happening, it's much more public health information. And so the church has asked me to talk about the COVID-19, and the COVID-19 is a disease that's recently discovered and is caused by a virus, and it's caused by one of the coronaviruses. So the disease is known as COVID-19. And this disease affects different people differently, and that's in different ways. Most infected people will develop mild symptoms or to moderate. There will be mild to moderate illness and recover without hospitalization. And I think this is why the government is encouraging home-based care. And so we are finding ourselves in this situation where there's a disease outbreak. We do not know any treatment of it. It's new. And this is not something unusual. It has happened over history, where many diseases have occurred, but human beings, God has given us the strength, the brains, and the skill to discover the treatment. So in the same situation where COVID-19 is one of the new diseases that we do not know any treatment. And this is what worries everybody in the world, a disease with no treatment. The disease can be transmitted from person to person and also from animals to persons. And this is where a lot of research is going on as how to deal with this virus. But one thing we must know now is that there is no treatment, there's no vaccine. I'll just share a little bit of the symptoms that when you're at home or when you are with a person in the family who presents these symptoms or these signs, you can easily say, well, I suspect. And one of the things that mild symptoms come up with fever, with a dry cough, and also the tiredness. But does not mean that when you have all these three things, you are having COVID-19. The less common symptoms are aches and pains, sore throat, diarrhea, headaches, loss of taste or smell, rash on skin, or discolorization of finger or toes. The serious symptoms that we really warrant you want to be hospitalized, and we have to take care of now. We have to take note of this, is when there's difficulty in breathing, that's shortness of breath, and when there's chest pain or pressure in the chest, loss of speech or movement. These three things are very critical. When you have somebody at home who starts showing this is the critical part that needs hospitalization. So on average, it takes 5 to 6 days to know that this symptom starts coming out. And also, we can wait until 14 days to know and confirm that you are really infected. But one of the things that are coming out is that the growing evidence, because it's a daily research, many different people are doing different research. We realize that this disease can be spread from person without symptoms. That means you can be very normal you don't show the signs of the COVID-19, but yet you have the virus. And so the growing evidence shows that you can get it from a person who does not show any symptoms. He or she has not been in the incubation period as other diseases, but this is a person who has the virus but is not showing the symptoms. Another growing interest is spreading the communities now. You see, when our country identified one person, it showed that there are many more people who had been infected that we did not know. So they were tracking and tracing those that were known, and yet the disease was spreading in different ways. So the more they test, the more they are getting, because the disease had already gone into the community. And so we are struggling with that. And also, we have to continue as a community or as a church to make sure that we don't pass the disease to another person. And how do we do this? And this is what they are explaining to us. It's not rules, but they are guidelines to help each one of us. Some people are taking them as rules. Putting on a mask, it's not that you must put on a mask because you've been told, but because that's one of the preventive measures that we put on masks. So I'll come to just on preventive measures and look at the stages at what we do, or the people health personnel or the Minister of Health is doing to guide you through what's happening, so that when some things are done or told us to do, they're not just things, they're helping us to overcome and prevent the spread of the disease. One of the things that is done is early diagnosis and prompt treatment. This means that once somebody has been identified as infected with the coronavirus, they have to isolate that person and treat that person. The isolation is to make sure that this person is not transmitting the disease. You have seen some people put under quarantine. The quarantine aspect is when you are suspected to have the virus, you are put in the quarantine. Then you are observed for 5 or 14 days in our country or globally, so that within the 14 days, you have developed the symptoms. If you have not developed the symptoms and they test you, you're okay. One of the things people have seen quarantine as a punishment is not a punishment, my brothers and sisters. It's one way of keeping us away from any form of transmission of the disease, because we suspect, as our minister says all the time, our Minister Kagwe says that you could be infected, I could be infected, because no one knows who is infected. So by quarantining those who suspect, that is one area of preventing the spread of the disease. The other thing is, when we have done the quarantine and isolation of those who are infected, one basic thing that remains now, and when there's any outbreak of a disease is fought by a collection of professionals, doctors, nurses, public health officers, the lab people, and all health professionals come together, and each one of them plays a role in what they know. One of the things that our country has focused on is telling us how the infection is, telling us the number of people who have been infected, the number of people who have recovered, the number of people who are sick in the hospital. That's one area where it's warning you, they're telling us that the disease is with us. The disease is going to be with us, we are going to live with it, and one thing that we have to do as a community, as a group of people, as church members, is to focus on the prevention strategies that we are being told. And some of the things that we are being told is we have to put mass education, which I'm doing now. Because the virus is transmitted from person to person, one of the things to avoid to come to close contact with a person you do not know. That means that you treat the person you are going to meet as infected, and that person treats you as also you're infected. And that comes in now the mask. When you put on a mask, it shows that you are protecting people. If you have the disease, you're protecting to breathe out the viruses so that you don't infect the other person. So when the other person has the mask, he's also avoiding to transmit the disease to you. That's the purpose of the mask. So it has to be well put on, not walking with it everywhere, but when you are near people, that's the most important thing, that you put on a mask, because you do not know your neighbor. The other thing is to share the information about the virus. The more we talk about the virus, the more we talk about the infection, the more we talk about the symptoms, people come to believe that the disease is there with us. So people take their personal responsibility on how or to avoid getting the infection. So it's so critical that when we are told with simple things that wash your hands, we are simply telling you that you could have caught the virus anywhere, on any object you may have touched without knowing exactly. So we tell you, please clean your hands safely. That's why we should clean our hands. The other thing is keeping a distance, because this thing is airborne, and when I breathe and I am infected, that means that the virus are within the air around me. And so that means that that's why they're giving a social distance of about 1.5 meters. That means that between me and anybody who is close to me, or who is closer to me, less than 1.5 meters, is likely to get infected when they don't have masks. And when I'm infected and I don't have a mask, I'm releasing the virus around me. And so that is very critical, that we have to observe the social distance. Social distance is just basically making sure that you keep a distance far away from one another. Not touching the surfaces. It's very important that when we are in a building, even your own home, make sure that your door knobs, any places, surfaces where visitors come in and touch, you make sure that you disinfect those surfaces. It could be on the tables, and especially when you are going into marketplaces where these rails are, avoid touching those rails, because people walk and hold those rails. It's very possible to see that the virus could be there. So one of the issues is catching, when we are told that because it is airborne, we are told if you sneeze or if you cough in your elbow, so that all the viruses are held here, so we don't let them go into the air. That's why we are told to cough in that form. So one of the things that is also very important, as discoveries go on, we realize that these viruses can also be found in toilets. And now this is a very critical piece to us who go to town, who go to hotels, and you go to toilets. These toilets, as somebody comes out of the toilet, when they have the virus, we are told that the viruses remain within the toilet. So as you go there, make sure that you have your mask. Any public place you go, especially the toilets, make sure that you have your masks. You will avoid to breathe in the virus that could have been left there after somebody has used the toilets. And so we're recommending fumigation of the toilets, and especially at church, we hope we shall be doing that we shall be fumigating the toilets immediately after somebody has used them. So there's frequency in fumigation. So when we clean our doors and keep the surfaces, keep our homes clean, and if you feel ill, keep at home, stay at home to keep safe, so that you see the development of what's happening on your body. If it reaches a point where you suspect that this is unusual, then it's good to seek medical advice. So as a church, why am I talking to you as a church about this? One thing as Christians, we know that diseases in history have occurred. If you read the books of Leviticus, you look at Deuteronomy and look at Numbers, you will see how God was instructing people to prevent themselves from certain infections. There's so much that you can dwell there. But if you just read the Leviticus from chapter 1 to 15 or 19, you'll find that there are so many instructions God was giving the children of Israel so that they don't get infections. And so as a church, we're also taking responsibility. When they open up, we shall be sure that we are going to put as a health, part of the health task force in this church. And just to give you information, we have a health task force and we are discussing. We are making sure that when the church is opened, we are going to make sure that we take measures to make sure that the people coming to the congregation are not, they don't get the infection. As a church, we are putting certain measures, and as I said, we are having a health task force, which we are consulting each other and listening to what the Ministry of Health recommendations. But we are seriously thinking together on what can we do, what can we put in place, that when you come back, when the church is opened, we shall all be safe. One is that we're making sure that each pew or each form only 3 people sit on. And we are making sure that in the compound as you come in, we shall check your temperatures. This is not, it's just a form of showing you or helping you to know that your fevers or your temperatures, your body temperatures are high. When they are high, we could suspect that this could be happening to you. But we shall see what to do when we detect that your temperatures are high. What do we do? As health professionals within the church, we shall work on that to see how we shall handle our members. The other thing we are putting in the church is that we have 5 water points where people will have to wash their hands before they come to church. And we have also put sanitizers on every entrance. This is just a form of prevention. One of the things we know is that after a service, it will take a long time. It could be 6 hours or it could be 4 hours before another service begins. Why are we doing this? When people come in and in case one of us or a few of us are infected and they have been breathing in the church, we shall allow that time to elapse where we know that ventilation has, the air has moved within the church, and so the possibility of the virus staying in the church is reduced or eliminated because we have to distance, we have to keep time, the period between one service to the other. It will not be as it has been going where everybody comes in, another one, they come in immediately. So those are things that we are working on as a church. So the other thing we have put in place, I have talked of 5 water points, and we have increased the interval of the service and reduced the service time. The service time, I'm sure, is between 45 to 1 hour. This is very important so that we don't crowd, we don't stay in the church for a long time. So in case any one of us is infected, we reduce the chances of infecting others. So sharing the information about COVID-19 and the symptoms and focusing that we do not have any treatment is very critical so that we take personal responsibility to keep away from any infection. The church has always been in the front line to fight any disease worldwide. As a church, we are responsible for any issue that happens to any member of the church. If any member of the church is sick, we are supposed to pray for them and support them and do whatever we can. It's just unfortunate that the government closed the churches together, but the church was supposed to work with the government to control the spread of this infection. And so we shall begin by informing you and teaching the public and teaching the community about the disease and how to stop the transmission. Thank you, and God bless you as I pray with you, as we pray for our country, as we pray for our families. Thank you. You're welcome to St. Matthew's when we open the church.